we know the science would have proven that after a while they start to wane, and that would have necessitated the need for booster shots after 6 months, especially for those who are 60 years and over and those who have pre-existing health conditions and
This
those who are at
is
risk,
Antigua
like
Newsroom.
our health workers. I mean, the cabinet last Wednesday recommended the commencement of booster shots for those who are over 60, for the vulnerable and those who are at risk. And I want to add here, subject to the approval of the technical committee, because I know that sometimes, some of these people on certain boards and committees, they try to flex muscles. So we're not directing them, but we want them to act expeditiously to get the approval process going so that people can start to get their booster shots in order to protect them. Because I'm pretty sure that, this
This is
winter
Antigua
season
Newsroom.
will see an escalation in COVID cases. I'm pretty sure that even among the vaccinated who will come to our shores to holiday, many of them, will import COVID cases. I mean, even our returning nationals, they'll bring back COVID. So we can expect to see a spike possibly in January, similar to what happened
Last year.
last year or this year.
Early
But
this year, yeah.
we're in a much better position today because over 60% of the country would have had at least a first vaccination, and about 55% are fully vaccinated. So the exposure among unvaccinated, would have been significantly reduced. And it means, therefore, we should not see the extent of spread and the extent of hospitalizations and deaths that we saw just recently in September. But again, for the vulnerable ones that I just identified,
This
it's
is
important for them to
Antigua
get their
Newsroom.
booster shots, because we can assume that there would be more, let's just say, I don't know if you should call it a silent spread of COVID, in the sense that, it says vaccinated persons, even though they represent a significantly less risk of transmission, they could well be inadvertently transferring the virus to others, including the unvaccinated. And, people may feel that they're in a safe environment among vaccinated persons and could unwittingly, contract or those who have COVID could unwittingly transfer COVID to those individuals. So that is why we have to continue to remain vigilant. And I suspect that we have at least 20,000 adults who are still unvaccinated. And that represents a sizable percentage of the population in which, COVID could continue to circulate and to literally result in maybe another 50, 75 deaths if we're not careful.
This is
So
Antigua
we will
Newsroom.
continue our public awareness and all of the education and persuasion to get those who remain unvaccinated to get them vaccinated, because ultimately, if they don't get vaccinated, they'll be courting death. And the upcoming winter season represents a significant opportunity for COVID spread, which means that the probability of contracting COVID would increase, and the outcome for the unvaccinated, as you know, could be hospitalization or death. And